Hi, everyone. Dr. Donovan here. Really excited to share what we have today on why bones matter. It's something I educate people a lot on in the clinic is how their osteoporosis profile relates to what they can do and what they maybe shouldn't do. All of these include lifestyle modifications and different ways of moving your spine and hips to help protect them over time. And of course, lowering your fall risk profile will mitigate any risk of acute fracture. So what are we talking about when we discuss osteoporosis? We're talking about bone mineral density, osteopenia, most likely older adults, and mainly postmenopausal women. But that doesn't mean you should stop caring about your bones, even if you don't have a degenerative bone disease. It's something to maintain throughout our lifetime. Fractures occur when a load into the bone outweighs that bone's ability to bear weight. This happens only in two ways. The first is through acute trauma that occurs from a fall, specifically onto a wrist, hip, or femur. This can happen at any age, but with the addition of osteoporosis, that bone can now sustain less force and create a greater fracture. In my clinic with folks that have osteoporosis, our first line of defense is minimizing the risk for falls. So the lower the risk for falls, the lower the risk for force or the risk for fracture. That will, on a month-by-month basis, decrease our opportunities for bone breaking events. In some cases, though, when falls are just kind of a part of what we're working on, we will practice falling in a safe environment to learn how to fall in order to spread that force more evenly and to reduce the likelihood of acute bone trauma. Lastly, in the clinic, to mitigate the negative side effects of osteoporosis, we improve muscle strength, reflex time, and weight-bearing exercises, all in an effort to decrease risk of falling. The second way a fracture occurs is when the load exceeds the threshold for remodeling. And without getting into the chemical details, our bone strength gradually weakens regardless of of the age we're at, anytime after about 35. And if that strain imparts a load in the wrong direction at too high of a force, a stress fracture occurs. So fractures occurs by osteoporosis most often occur in the spine. And these spinal fractures are called vertebral compression fractures. And they occur in the rate of nearly 700,000 a year. They're only diagnosed based on X-ray imaging, so I imagine the prevalence is likely a little higher than is captured in the data. This compression fracture is twice as common as other fractures linked to osteoporosis, such as broken hips and wrists from falling. So enough of the bad news. What's our solution? Let's look to posture. An exercise protocol to strengthen the spinal extensors, both in low loads and in higher intensity. But I really just want you to understand how the force through the spine leads to these vertebral compression fractures. So I'm going to illustrate with two segments of the spine, this one and this one. And you can imagine these get stacked up all the way up from your low back to your head. And we want to encourage a uniform force for bone health. So we want to distribute force equally in all directions. So I'm using my stacked hands, and I encourage you to use yours at home to just kind of give you a picture. Let's say this is our face, to give you a picture of what these spinal segments look like, say, in a kyphotic spine. So kyphosis is when we're kind of hunched forward through our middle back. So you imagine all the segments are tilted a little bit forward. And so where is that going to put more force on our spine? That's in the front. So in the front of our spine, there's more of the top segment bearing down onto that bottom segment. And in order to undo the potential for this risk, we want to spend more time in sustained upright posture. So we want those vertebral segments to be stacked on top of one another. You can imagine even when if we're picking something up or we're twisting to get the dog food, if you're tilted forward and you're adding weight to that, that's magnifying the risk for these compression fractures over time. So let's all sit up straight, just like we were taught when we were younger. So I'm going to demonstrate really quick is that if we're forward and those segments are leaning forward on the front sides, we want to be as upright as we can using those muscles that go left and right of your spine. So maintaining bone integrity, where do you start? I know this can all seem overwhelming, but luckily you have some time to start working on your bone integrity and minimizing negative effects from osteoporosis. So what we're going to talk about the next few minutes is where to start. And of course, that just means getting baseline measurements. So we don't know where we're going until we know where we're at. And that means we're going to do a few things. For one, we're going to learn what our fracture risk is. So knowing your risk means knowing what you need to do to mitigate a spinal fracture. Just like you don't prepare for retirement when you're 60 in a financial sense, you start making preparations and contributions much earlier. And this is a bone calculator tool to see how long your bones investment should last. So I have this QR code here that you can scan with your phone, but I'll also put my email address here if you're watching this on your phone and can't get the QR code. So I filled out this fracture risk calculator and I put in kind of the best case scenario, 50-year-old female, no comorbidities, put me in the low risk category. As you can see, I'm in this kind of green area. And it only takes a few minutes to do this, but to compute your chances of fracture is phenomenal information going forward. And again, waiting until you get a fracture is not the time to start worrying about it. Just like you wouldn't expect to survive your retirement without saving in your 30s, 40s, and 50s. So even in this low risk category, the preventative strategies are administered in a handout. It includes daily calcium, vitamin D goals, reminder not to smoke, and encourages weight-bearing activity. And all these are current recommendations set out by the National Osteoporosis Foundation, and they're all things I feel comfortable talking about in the clinic. So if you are having trouble with the QR code, just send me an email at patrick@heatherlanept, and I'll send you this link. So the next step on the where do you start with mitigating osteoporosis risk is getting a DEXA scan. These are recommended for postmenopausal women and men generally older than 50. So when consulting with your primary care physician, or if you have a bone doctor, they may also assess your bone mineral density with a DEXA scan. The scan measures the bone mineral density at specific points in the body, and they're compared to young adult reference groups. So if you have normal bone mineral density, you're within one standard deviation of your younger version of your female or male self. Osteopenia is between 1 and 2.5 standard deviations, and then osteoporotic is anything below 2.5. So if you are in osteoporotic zone, stay tuned for future videos that outline everyday solutions. These conservative treatment options for bone health can help to maintain the bone you already have and slow the disease progress. So today we talked about getting a baseline measurement. And in the future episodes, we're going to talk about a few more aspects that'll help with your bone health, just because I can't get it all into one. There's just too much. This is the QR code for the bone risk calculator again, if you want to scan that with your phone in the picture setting. And then in future videos, we're going to understand your treatment options that includes pharmaceutical and injection options, to find your partner in bone health, whether it's a physical therapist or a primary care physician. And then we're going to talk about actions as needed. Because with the spine, we do want to be careful, because if you're osteoporotic already, you're already in a going through a disease state. So paying special attention to your deficits and impairments is really important, whether you're showing up to my office or going into a Silver Sneakers class at your local Y. So stay tuned for future lifestyle solutions to maintain bone integrity.